an online showcase of the Faculty of Health and Medical Sciences degree offerings for 2023. Thanks for joining us tonight. For our webinar regarding our nursing programs. My name is Matt, and I'm a future student advisor in the Future Students team here at the university. To begin, I'd just like to start off by acknowledging. Sorry. Oh, hiccup there. I'd just like to start off by acknowledging and paying respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present, and ongoing contribution to the land and cultural beliefs. Okay, I'd just like to introduce our panel now. So we're starting with Frank Donnelly and Lisa Conlon, who are program coordinators and academic staff within the nursing programs. I'll just get Frank and Lisa to introduce themselves.
Yeah, hello. My name is Frank Donnelly. I'm the Dean and Head of School at the University of Adelaide. Lisa?
Hi, I'm Lisa Conlon. I'm the pre-registration program coordinator for Adelaide Nursing School.
Thanks very much. We also have a student here who's in the second year of the Master of Clinical Nursing, Brian.
Hi, everyone.
Thanks, Brian. I'm just going to hand over now to have the academic leads present some information about our nursing program.
Okay, so thank you very much. And it's lovely to talk to everyone at the moment. Look, we're going to lead with some nice information about our school. We are a small school, and we value quite a lot, I suppose, our capacity to impact really good nursing education. So we are ranked #1 in Australia for the overall experience. We are 46th in the world, and when you think about the number of nursing schools that are out there, to be in the top 50, in the top 100 is actually a wonderful achievement. And we are ranked first in South Australia. So if people are thinking about studying in South Australia, you would be looking at being at the #1 nursing school. Next slide, please. So look, it's a wonderful little montage of, I suppose, our graduates. And for me, what it reflects really lovely is that we have a range of disciplines that we work with and across our programs. And I think what that does is that contributes to us having such a high level of student satisfaction. We are clearly above the national average in terms of overall satisfaction and full-time employment. And our graduates are particularly in demand for many reasons, which I'll go into over the next few minutes. Yeah, next slide, please. Yeah, thank you. So as I said, we're #1 in South Australia. And I think the things that separate us and enable us to be #1 is the fact that we have a really close connection with our students. People like Lisa, who you'll hear from shortly, as the smallest program in South Australia, we value, again, getting to know our students and getting to know their wants and needs. And we place a great degree of emphasis on students developing those hands-on skills. So, you'll see a particular focus in our program on assessment, for example, and that's something that we, again, see translating very clearly into the clinical environment, and especially for people interested in a career in nursing, into employment, because you have transferable, relatable skills that you develop very quickly and are sustained throughout the 3 years of the program. So our Bachelor of Nursing is a very successful program, and we're very proud of it. Next slide, please. So you're looking forward to 3 years. We only have an annual intake at the start of the year, so there's no mid-year intake. Our simulation facility is second to none, and I'm sure, again, there'll be links that you can access to have a movie, if you like, or a video to walk you through the simulation setting. Clinical placements, nursing is a practice hands-on profession. So, tying the experience that you gain in the clinical placement setting to the theory that you're going to listen and integrate in your classroom learning is really, really important for us. Our curriculum is contemporary, and what we mean by that is that our nurse educators, our lecturers, work in the clinical setting. They're also practicing academics, so they bring to their content and to the lectures, they bring a really strong and translatable degree of knowledge. And what I mean by that is that if we're talking about an issue of clinical practice on a Monday or Tuesday in class, if a student is on placement in the week after, we would be wanting to see how that student is integrating that practical and theoretical knowledge together. And again, that's a really wonderful hallmark of our programs. And as I said, that video at the start was a lovely example of how we have an opportunity to work interprofessionally with people. And our students will be at times in class with people from medicine. We've got an opportunity to expand our connection with allied health in the next few years. So, nursing students working alongside students in physiotherapy, for example, to, what is the best way to help someone mobilize after an operation? What is the best way to help them walk if they haven't walked for a long time? And so you see that there's this connectivity between different professions. And again, that's a really wonderful aspect of our programs here at the University of Adelaide. There's always tremendous benefits, I suppose, to being in a small cohort program such as we have. And one of those is our overseas study tours. And I've been very fortunate to go on a number of study tours to places such as Japan. We've got study tours to Austria, Canada, with Singapore. We've pretty much sent students to each end of the globe. And the stories that they bring back about the transferability of nursing skills and knowledge is one of the things that really does appeal to us. We want students to have a sense that a career in nursing is portable, and so again, we had an application only just the other day of a graduate of ours that had gone on. She's worked in England, now working in Canada, and now she's looking to move to the United States to do further study. So this is a wonderful thing. Of course, unfortunately, the last 2 years we've had some impacts of COVID. We're hoping to get through that and re-establish our study tours for our programs. Next slide, please. Oh, what's involved? Oh, lots. Look, we think one of the things that's really important when you take a decision to move into a clinical oriented career is to have an early experience and opportunity to help you decide if you've made the right decision. So our students will go out in either first semester or second semester of first year. And again, that gives you an opportunity, I suppose, to think and to see, well, have I made the right choice? You know, is nursing going to be a career for me? And sometimes it is the thing that actually cements that person's decision to continue with this health profession. There is a lot of clinical placement, over 1,000 hours across 3 years. And again, that's critical because our nurses graduate and they are as prepared as they can be because we have our theoretical and our simulation training underpinned by the real world experience of clinical placement. And if you're out, say, for example, on a 4-week rural placement, you really are going to have a unique experience, I would suggest, especially for people from overseas who may be wondering what just is it like to be in a small Australian rural setting. Small class sizes. So yes, we have large lectures, but we break all of that down into smaller class sizes through tutorials and problem-based learning sessions. And again, this is where students have an opportunity to talk with one another and to swap stories about what did they see last week on their clinical placement. And again, that's that sort of informal learning that is particularly valuable in this sort of setting. I'm not sure if there's a fly through of the AHMS building, but I have to say this is where I work in the AHMS is a beautiful building. It was designed with a key principle to be a centre of educational excellence. And if you were to look through it, you would see how the lecture theatres have been built for that purpose. The simulation setting is fantastic, as I said. And it's again lovely because where the students are studying and learning is where our lecturing staff sit. And so again, there's an opportunity for constant communication and connection. All right, next slide, please. When we talk about clinical placements, and you're doing clinical placements across 3 years, we want you to appreciate the diversity of what nursing is. And our staff come from a wide variety of backgrounds. My background is intensive care. Lisa's background is perioperative and disaster management. And what it means is that when you are talking to people within the school about your placements, you are actually talking to people who've been in those environments and worked through those particular issues. And again, this is really, really important because we make connections with industry that benefit you when you're out on placement. Placement is compulsory. We make no bones about that. And you could be working anywhere from a start of an early shift at 7 o'clock in the morning to finishing at 9:30 at night and anything in between. And so again, if you do think about a clinical career, this is really important because this is your life. This is going to be the reality of your practice going forward. The reason that we have compulsory rural placements is because, one, Australia is a very big place, as you may appreciate, and there is a need to distribute the skills and knowledge that we have as practitioners across many parts of that. These are often seen as sometimes challenging for people, particularly who might not have experienced Australia in that context before, but invariably when students come back from placement, they have loved the opportunity to go out to those rural settings. Next slide, please. The preparation for study, and again, what we really want to be as well is upfront with people and quite, and we would encourage you, please investigate the resources on the websites at the nursing school. Find out what it is that you're signing yourself up for. And there are a list of inherent requirements that are actually quite important to look through. And what that means is you have a particular issue. You need to think about how your nursing career would be able to accommodate that. We do need you to be conscious of the need for immunisations, and that includes COVID-19, that includes flu, that includes pertussis for whooping cough, a wide range of expectations and need for you to have to come into a health-oriented profession. And sometimes we get the question, young people particularly will ask, well, why do I need to have a flu vaccine? Flu vax, I'm not going to get sick. Well, the flu vaccine, as an example, is not for you, it's for the people that you will be going to look after. Elderly people that you might inadvertently, pass on a germ or an illness. And that's, again, what we don't want, expose anyone to. Tuberculosis screening, criminal history checks. Of course, we would anticipate that anyone going out into a clinical setting is of a fit and proper background. And student registration is a requirement in Australia. And what that means is that your name is submitted by the university to the registering body in Australia. That's all it is. It doesn't cost you anything. It's just a record, if you like, of you undertaking a course in Australia leading to registration. So I'm registered. If you need to or want to, you can look me up on the public web page. Students are not seen on the public web page. So this is a hidden, if you like, registration process. But again, it's important that you know that that would be an expectation of enrolling into any program, not just the one at Adelaide, but any program in nursing. Next slide, please. Wow. Look, it's a pretty simple Google search, and the world is actually suffering a shortage of nursing or nurses at the moment, and this is not going to be a problem that's going to be fixed quickly. So as a career option, this is one of the best that you can identify or run with. All of our graduates from last year were employed. So that is an incredible sort of selection, I suppose, or recognition from industry of, one, the need for nurses, but also the quality of our graduates. If you were to, and again, your qualification at the University of Adelaide is very portable, so you could travel overseas and work elsewhere. And I go back to the example I just gave before. Your qualification will be recognised in the large amount of English-speaking countries that you might go to work in, and others as well. Where will you find work? A large proportion of our graduates will go to work in an acute care setting, and that's something like a large tertiary hospital. But you can also go and work in aged care. You can work in mental health. As I said, you can migrate out into the rural setting. Pretty much anywhere that you can think about, there will be an opportunity for you to extend your nursing career. Next slide, please. Okay, so admissions information, again, if you've got any particular detailed questions, you can follow those up in the chat box. But domestically, for our admissions information really is that you need to have an IELTS of 7 across all bands. And what that means is that you are able to clearly converse with the people that you'll be looking after. And we don't want anyone to feel very uncomfortable or out of place if they don't have the capacity to communicate clearly. Our ATAR or our academic scores, we have a cohort. We will take about 350 students into our programs, into our Bachelor of Nursing program. And so the higher your ATAR, obviously, the more competitive you are. And so if you have any particular concerns that you might not be getting there, there are a number of options for you to talk about the admissions processes and people with at the University of Adelaide. What's helpful, we don't have any prerequisites as such, so we don't ask you to go and study biology at year 11 or year 12. Clearly, if you do, that and mathematics will be useful. But equally, we would suggest that English is a good thing to have as well, because, and I would say this at any venue that I talk at, being able to communicate is probably the most important skill that you can have as a registered nurse. And so verbal and written communication is a really critical component of what we do. Next slide, please. Oh, there we go. So the Q&A session.
Great. Thanks very much, Frank. That was excellent. We're just looking into now, it's time for the audience component. So if you do have any questions, feel free to enter those into the Q&A box at the bottom of your screen. And it can be a question relating to the presentation, something from our student panelist, Brian here today, or any general questions about studying at the University of Adelaide. Really happy to help with any of those. You can also choose to submit your question anonymously if you prefer as well. There are really no bad questions. Okay, so a question from the audience here. A student who's currently studying the Health and Medical Sciences program with us and would like to transfer across to nursing at the end of the year, what would be the best way to go about this? Lisa or Frank, would you like to handle that one?
Yeah, sure. So the first thing I'd say to the anonymous attendee is how far into your program are you? Because we actually have another program leading to registration, which is our Master of Clinical Nursing. So if you were perhaps 3 years into your degree, I would suggest to finish it, to be quite honest, and then ask or inquire about the Master of Clinical Nursing program. If you've only just started and you're thinking health and medical sciences wasn't for you, then yes, we would certainly encourage you to consider the Bachelor of Nursing program. So that one sort of depends on where you're at in the progress of your current degree.
Absolutely.
Just started this year, so I'm just following up. Sorry, Matt. And yeah, yes, please come and talk to us. I'm sure Lisa would love to have a chat and get your feedback.
Yes. Yeah, please come and see me.
Yeah, in terms of admissions processes, typically a GPA 5 or higher to meet the transfer requirement, and you launch a new SATAC application rather than an internal transfer application. Applications for the next intake will open, I believe, on the 2nd of August this year via SATAC for domestic students. But yes, thanks very much. Got another question here. Are there any considerations for students who have completed a Diploma of Nursing?
Look, I think this is sometimes a tricky one in that clearly we recognise that people have previous experience and background, and if someone has done a Diploma of Nursing elsewhere, we would look at some credit status towards their program of study. If someone is working overseas as a registered nurse, then there are other programs in Australia that enable them to transition to an Australian registration. That's not something we do. And so sometimes people are disappointed when they ask how much credit can I get because I was a registered nurse overseas. It's probably not going to be the best path for them. And we would encourage them to look at other transition programs within Australia.
Yeah, just to expand on that a small amount as well. If you have completed a TAFE Diploma in Nursing or equivalent, we do have an enrolled nurse pathway into the Bachelor of Nursing, which can award up to 1 year of credit towards the degree. As Frank mentioned previously as well, if you are currently studying a bachelor's program and would like to look into switching to a career in nursing, if you are quite close to finishing your program, you may be better off looking into the Master of Clinical Nursing. The same would apply if you hold a bachelor's degree from prior studies internationally or within Australia and would like to transition to a career as a nurse. Okay, question for the student panelists here. What do you wish you knew before starting the nursing program?
That's a very good question. Thank you. So for me, I think I wish to know more about basically what I really want. So because as a mature student coming back to study at the University of Adelaide, in the beginning when I was doing bachelor, I sort of lost kind of my directions after high school. I don't really know what I really want. But I think a lot of people are like that. So that I just enrolled to a random degree and then just finished that. And then after that, I developed passion in nursing. So then I wish that if I can travel back in time, then I will probably set my mind and set my goal into nursing and come to University of Adelaide straight away.
That's great. Thank you. It's definitely something to consider, particularly with the clinical program. If you're not sure what you'd like to do at first, finding out later, always great to kind of look back and think, oh, I wish I did this earlier. Now, another question here. Students that will be going overseas for an exchange, on average, how much does this usually cost? Any, Frank or Lisa, do you have any advice for overseas exchange study?
I might have to leave that one to you, Frank.
That's okay. Look, I could be smart and say that it depends on how much you like to shop, but you know, so the trips are collaborations really, and we partner with universities overseas. So that I'll use the Japan example. We connect with Hyogo University in Kobe, Japan, and they offer accommodation through their student network for our students. So that saves a lot of money in terms of accommodation costs there. It's a little bit different with Austria. It's a little bit different again with Canada. But, you know, essentially the airfare to get there, and then there's a smaller fee associated with accommodation. But as I say, if you're interested in that as an activity, good time to start saving.
Just to expand on that a small amount, in general, for most exchange programs, you continue to pay your local tuition fee to the University of Adelaide. We'll do an exchange with a student from another university, so you don't pay any extra fees for tuition overseas. You can also, in some cases, be eligible for what is called an OS help loan, which can provide a loan of, I believe, up to around $8,000, which gets added to your HEX debt for HEX eligible students as well, which can really help with deferring the cost of exchange study if necessary. Great. I've got a question here as well. What are some challenges you face as a nursing student? Brian.
I think really I'll answer that question. First thing coming to my mind will be time management. I think it's really important because, as Frank mentioned, for the Bachelor of Nursing and also Master of Clinical Nursing, you'll have clinical placement. So you actually learn a lot during the clinical placement because a lot of hands-on experience and also working in the hospital and also with other nurses. But the most important thing that I find out is how you juggling time, because you'll be working in a 24 hours, kind of like a 7 days a week service. So you probably need to juggle your personal life and also work-wise, and also how you get your assignment done. So yeah, time management will be the tip, or also maybe some sort of challenges. But once you get that set, then it should be okay.
That's great. Thank you. Absolutely something to consider, particularly when you have those roster-based kind of block placements taking place, certainly. Another question for Brian, the student panelist here. What's been your favorite experience so far in the Master of Clinical Nursing?
That's a very good question. So, so far there's two placements that kind of inspire me a lot. One is at a pediatric setting at the emergency. So I actually quite like, because I have another background before working in childcare. And then I never thought that pediatric emergency was quite different. And then you're not just dealing with the child itself as the patient, but you're dealing with the entire family. So we call that family-centered care. So instead of patient-centered care, you're jumping up to another level, as in you're looking as a whole perspective into the family and how you're going to help them as well. And the other one is I really like my rural placement. I actually just got back from Renmark, so it's quite different from the metropolitan setting. So the rural, it's more a place for you to consolidate your skills and also use your clinical decision and judgment, because maybe the facility is a little bit different, and so then you get to use what you have learned from the university and also your tested knowledge kind of incorporate into your decision making while you're looking after patients. So that was quite interesting, both of them.
That's great, thank you. Another question, what are some of the differences between the Adelaide Uni nursing programs and other universities in South Australia?
I'll take that one, Matt. Look, again, we are the smallest program in South Australia, and some people might think that 350 student intake is not small, but other institutions will take upwards of 1,000 students. So look, that works both ways. One, it means that you get a more personalised relationship with your clinical lecturers and facilitators. They'll get to know your names. On the flip side of that, it means you can't hide, and so you're not just a number lost in the pack. But almost all of our students, I would suggest, and Brian, please jump in, is that's some of the things that appeal to people about doing the program here at Adelaide. They want to make a connection with people who are passionate about nursing education. That's really what we're about, passion.
And echo on that point, I think the facility here at the University of Adelaide Nursing School, I think we do have a lot of good facilities going on, because the AHMS building, which Frank mentioned earlier, it's actually they kind of turn into the entire classroom space into a hospital. So it looks like you're learning while you're in the hospital as well during the clinical classes. So, and the teachers, they actually remember your name. So yeah.
And I think I can add a little bit to what Brian's just said as well. When the students come in to do their clinical simulation lab sessions, students come in uniform, so they actually are really immersed in a safe learning environment to perfect some of the skills that they need to before they go out into clinical placement. I think that's a really big selling point for Adelaide as well.
Great, thank you. Another question, are there many mature age students that undertake the Bachelor of Nursing?
Do you want me to have a go at that one? Yes. Actually, we have an incredible number of mature age students. We have mature age students that have decided after having another career that they would like to do nursing and do a Bachelor of Nursing program. We also have many mature age students that have another first degree like Brian, who have had another complete career and decide that now is the time to do what they would really like to do and start nursing. So we do have such an incredible cross-section of ages in our program, and I think that's one of our great strengths, that we do have so many different people coming together with a shared passion to become nurses.
Yeah, to expand on that a small amount as well, yeah, it's certainly going to be like any of the professional career pathways similar to nursing. It does attract a much more diverse cohort than you'd normally expect for a directly, school leaver background. So, yeah, I certainly wouldn't be too worried about, cohort differences there.
In fact, I think it's an incredible thing. I think it's something that is one of the great strengths.
Absolutely, thank you. Another question here for Brian, this one. What is the culture like at the University of Adelaide? Any general advice for that one?
The culture like at the University of Adelaide, very inclusive, people are very friendly, everyone's very genuine. And also, I think the tutor here, they are all other like, maybe I should say they're partially a tutor, but then they're also working in the industry as well. So then you get the most updated skills and knowledge because they're also working in the hospital along working, juggling the time, teaching us as well. So then it's very inclusive, and also I think it's everyone here very knowledgeable, and the skills that they can provide to us is very up to date. And then, so yeah, it's very good.
Thank you. Now, another question here. After practicing as a registered nurse for some time, if somebody wanted to advance their studies or change professions in healthcare, what would be the general process? I suppose for the first part of that, how would somebody become specialized in their chosen nursing field with us?
So once students have completed their undergraduate program, what we generally suggest is they go out into the real world for some time, and they bed down their basic skill set, and that gives people an opportunity to look at the specialties where they might want to specialize further. I'll use myself as an example. So when I finished my undergraduate, I went to a neurosurgical ward and I went to the intensive care unit, and for some reason I just gelled with the intensive care environment. And so I went on to study a graduate diploma in intensive care. And that gave me the specialist knowledge to work in that environment for another 13 years at the time. So, and that is a really wonderful thing about a nursing career, is the diversity of environment that you can move to. Now, if I had got tired of working in intensive care and I wanted to change to mental health, I could, and I would undertake further study in that specialism and then look for an employment opportunity in that space. So that is really one of the biggest attractions for a nursing profession or background, is that transferability of skill.
That's great, thank you. For the second half of that question, I suppose, changing professions within healthcare to a different non-nursing but other allied health professions such as paramedicine. We don't have a paramedicine program here, but typically any institution that offers a graduate level bridging pathway, you would typically be able to use your academic results from your studies in your nursing degree to then apply and complete a pathway. There may or may not also be credit depending on credit for prior learning, depending on the specific requirements and accreditation requirements for the other profession you're looking into. Thank you. Another brief one here. So for domestic students currently studying engineering, transferring across to nursing, how will this be possible? In this case, it is similar to what we discussed earlier. You can use your academic results once you've completed at least one semester of full-time study or part-time equivalent. We're happy to use your university results and you can apply for transfer. Domestic students will apply through SATAC as of the 2nd of August this year, when applications open for the 2023 semester 1 intake. Another question here, if somebody hasn't taken mathematics or biology, will they be at a disadvantage compared to other students that have taken those subjects?
They may feel like that, but like all things, we would encourage people to be realistic, and and often there's a fair bit of lead time into the commencement of a semester, for example. And we see some students have finished year 10 with their maths. And yes, they are going to have to do some additional study to come up to speed. Now, maths in nursing is not that difficult, I don't believe, but I completely understand people have concerns about their current level of maths skills. So we work with students, we identify their needs, we offer diagnostics. There's some really wonderful, sophisticated online support programs to help with students' maths and development. So most people will be able to address any of those sort of background knowledge needs before the end of the first semester.
Thank you. To expand on that to a small extent, typically programs that have a prerequisite of a subject, there will be some formal knowledge required. Nursing doesn't have prerequisites, it just has some kind of recommendations. You will learn everything you need for the mathematics component as part of the degree itself. But if you are coming in without taking maths for a large amount of time, we do have a really good maths learning center available on campus. You can come along or attend a Zoom appointment and go through any maths questions you might have to help bring yourself up to speed on in the event that you find you need some extra assistance with this. Great. Another question here. After the undergraduate degree, when you're doing further study for a specialist area, are you still able to stay in the work environment while you go back to study? Frank?
That's a great question. And in fact, the irony is you can't do further study unless you are in the work environment. And so this is, again, when we talk, we offer a graduate diploma in intensive care nursing. To do that course, you actually have to be working in the intensive care unit. And that makes sense. I mean, we want you to see on a day-to-day basis how the knowledge that we give you and the skills that we give you translates directly into patient care in the area. So to answer that question, you have to be in the work environment to do study in a specialist setting.
That's great. Thank you. To expand on that a small amount, essentially, my understanding is that if you are employed as a nurse with the requisite amount of work experience in your specialty area at 0.64 FTE or higher, I believe, then that's the type of workload we'd be looking at for you to then go on and take on specialist study, since you will be applying what you're learning directly in the workplace to integrate it to a higher extent. Great. Now, another question regarding open days. Are there any open days coming up? Yes, there are. We're doing a face-to-face open day on Sunday, the 14th of August this year. We have a web address that you can take a look at adelaide.edu.au/open day, which contains some additional information that will be updated over the coming months. Open day will be on the 14th of August, and we will also be doing an online open day slightly after the face-to-face. More details will be provided a little closer to then. Open day is typically a great time to come along and meet our students and teaching staff within our programs, as well as to have the opportunity to tour our facilities. We will typically do tours for the North Terrace and AHMS campuses in Adelaide, and we've previously used a shuttle bus to accelerate the process of moving between those two places. Just do remember to bring an umbrella, because open day is traditionally a wet day in August. Just having a look for some additional questions. Would completing an honours degree in nursing result in further job opportunities or more practical procedures in the workplace?
Lucy, you happy if I take that one?
Yeah.
So look, I think probably not, and that might sound a little bit counterintuitive. The honours component of your degree program is really a stepping stone to a PhD, and so having a good result in your honours is like a ticket to a pathway involving research. If you wanted to do a more clinical, procedure-oriented, practice-based career, then that's when we would suggest very strongly to do a graduate certificate, a graduate diploma in the specialty that allows you to do those procedures. So honours is more about learning how to do research. The graduate diplomas and certificates will be about how to do certain procedures in a nursing environment.
That's great. Another question here for Brian.
Yes.
What are some extracurricular activities that you can get involved in during your time at the university? Do you have any recommendations?
Yes, of course. So there's a lot of clubs you can join at the University of Adelaide, But as a vice president this year of ANSS, so Australia Adelaide Nursing Society, Student Society, we actually do offer nursing student clubs that you can join. So we host a lot of events within the entire year. Each semester, we'll go out and we'll invite guest speakers to come in to talk about maybe different topics such as diabetes and stuff that you're interested. So a lot of clubs that you can join. So if you're not interested in joining the nursing clubs, there's other sports clubs that you can join at the University of Adelaide.
Absolutely. I do recommend, regardless of the program you choose to study, certainly look into your student club for that program or specialty within the program, as some of them are quite specialized. And we also have, I don't know the number of clubs, it is over 100, all directly
180
available.
Something, yeah.
Yeah, it's many clubs in a lot of different fields. University Union Clubs page provides a breakdown for all the different clubs we have. Recommend having a look there. Generally during orientation week, the week before you start your classes, you get a good chance to come along to campus and meet the various club ambassadors and learn more about each of the clubs and potentially go ahead and join then and there. Great. Just taking a quick look. One other question. What differences are there between practicing as a registered nurse versus a nurse practitioner?
Do you want me to have a go? It's really very different. Practicing as a registered nurse, you practice within your scope of practice as the level of expertise and the level of education that you have attained. To become a nurse practitioner, it's a master's degree. It is a very intense degree. It involves many hundreds or thousands of hours of clinical practice prior to actually qualifying to become a nurse practitioner. So they're really very different. They're still registered nurses. Both are registered nurses. A nurse practitioner has a much greater scope of practice, a much greater license of practice. But it is a very intense program that registered nurses take on to become a nurse practitioner.
That's great. Thank you. Looks like this is about all of the time we have tonight. Thank you very much for coming along to attend. If you do have any additional questions or would like to chat with the future student team members one-on-one, you can email us at start@adelaide.edu.au. You can also give us a call. Our phone number details are on our website. We're also happy to do a call back at a time that conveniences you. If we don't get a chance to answer your question live today, you can email the future student team. We're more than happy to help. You can also visit our website at adelaide.edu.au for an overview of all of our degree programs, admissions procedures and similar. Our Degree Finder website is an excellent resource for standard kind of information queries about, things like tuition fees, program structure, what you learn, career outcomes, and this type of information. So the Degree Finder is an invaluable resource for this type of thing. As we mentioned earlier, we will be having our open day coming up on the 14th of August, Sunday, the 14th of August. So pop that in your diary, and it's the best way to explore the campus and facilities and the resources we have on offer for our future students. So that about wraps everything up for tonight. I'd just like to thank our panelists, Frank, Lisa, and Brian, for coming along to provide their time to help answer some questions from the student body. And I'd like to thank everybody attending for joining us today. Thanks very much and good night.